Hello, this is Dr. Leonard Pascual, and I'll be lecturing to you on the anatomy of the heart and lungs. Now, for the learning outcomes for dentistry students, you'll get to know the different parts of the mediastinum in terms of the contents. We'll look into the connective tissue wrappings of the heart and lungs and mediastinum. And important for you would be for the heart would be the chambers, the valves, and the inner walls structures. And for the lungs, maybe at your level, we'll just name the different bronchopulmonary segments. When studying the anatomy of the chest compartments, the one that stands out the most is the middle division called the mediastinum. It extends, it's a chamber or a division of the chest that is enclosed by the sternum in the front and the spine or the vertebral processes of the spine behind or posteriorly. So all that it contains are all the viscera of the thorax except the lungs. So the blue cylinder I've been showing you earlier that refers to the mediastinum refers to that uh, the anatomical structures that exclude the lungs, as you can see in the left side of the screen. So there you see a picture of the heart and the great vessels and connections of the trachea to the lungs. So the roots of all those blood vessels and the roots of all those airways are enclosed in the mediastinum, since we have defined the mediastinum as everything except the lungs. Here is a cross section of a thorax, a human thorax, where you see the mediastinum is that structure in the middle of the body of the chest that encloses your heart, the great vessels, the roots of the great airways, the lung airways, and ascending and descending blood vessels, as well as all the lymphatics, all the connective tissue, and the fat tissue inside. Now, that blue cylinder can be divided into two. So, the mediastinum has an upper part and an inferior part. So, superior mediastinum and inferior mediastinum. The superior mediastinum is limited by the opening or the superior thoracic opening, as you can see here. Basically, it's like the chest, the ribs is a hollow container, and the upper opening of that container is the superior thoracic opening, which is also the upper limit of the superior mediastinum. The lower limit of the superior mediastinum is at the level of a plane from the sternal angle in front, if with regard to the sternum, or a more exact delimitation would be at the level of the intervertebral disc between the fourth and the fifth thoracic vertebral body. So here an X-ray would show that the top, that superior mediastinum, so it's above the heart, so it includes that major blood vessel over there. So for every compartment I discuss, I'll enumerate what organs are found inside that compartment and the blood vessels inside. So for the superior mediastinum, it contains the esophagus, the trachea, the thymus gland, and the thoracic duct. So the esophagus is part of your gastrointestinal tract that connects your mouth to the stomach. The trachea connects your upper airway to your lungs. The thymus is a immune system organ that produces your B lymphocytes, and the thoracic duct is a major pathway for the lymphatics. As to the major arteries, right up there is the arch of the aorta and its branches, the brachiocephalic artery, the left common carotid artery, and the left subclavian artery. We only have one brachiocephalic artery because on the left side it's already split and they originate straight from the aorta, and that is the left common carotid artery and the left subclavian artery. On the right side, The right common carotid artery and the right subclavian artery arise from that brachiocephalic trunk or artery. As to the veins, it contains the superior mediastinum contains the innominate veins, the upper half of the superior vena cava, which, as you will see later, drains the upper part of the body into the heart, the left highest intercostal vein, and the right and left brachiocephalic veins. So the venous system doesn't have a counterpart for the aorta, at least not in the adult human. And now we get to the more exciting part of the chest and lungs, the inferior mediastinum, which can be subdivided further into three parts. An anterior part, which is quite small, the main part, which is the middle mediastinum, and the posterior mediastinum, so everything behind the middle mediastinum. Now, the boundaries of the tinier compartment known as the anterior mediastinum, you have the sternum in front anteriorly, the connective tissue wrappings of the lungs and of the heart. What's inside? So, nothing much. A bit of fatty tissue, a bit of lymphatics and lymph nodes, and some small branches of the internal mammary artery. Now, to put it into context, the anterior mediastinum does not exist everywhere. It is only seen on the left side, where the connective tissue wrappings of the left lung or pleura splits from the mid-sternal line. So it's slightly left of center. So just to put it into context, the anterior mediastinum of the inferior half of the mediastinum is a very tiny compartment. So most of it is occupied by the middle mediastinum, and the remainder of the space is the posterior inferior mediastinum. So the inferior boundary of the posterior inferior mediastinum is the big dome of the diaphragm. In front, you have the protective covering of the heart. Behind, you have the spine. So what's inside? For the major artery in the posterior inferior mediastinum, you have the ascending aorta. For the veins, you have the azygos vein, the hemiazygos veins, and the accessory azygos veins. For the middle mediastinum, this is mainly the heart itself and its protective wrapping, the pericardium or pericardial sac. What's inside, aside from the heart, is the ascending aorta and the pulmonary artery and its branches. For the veins, the lower half of the superior vena cava, the azygos vein, and the right and left pulmonary veins. As to the nerves, the important phrenic nerve, which innervates the diaphragm, without which we would not be able to breathe. Other contents, as I mentioned, is the heart itself and the trachea as it branches and penetrates into the lungs.